As doctors, we have a whole range of skills that we bring to non-clinical roles. And one of the great things about medicine is that there is such a variety of roles clinically and people in medicine. And so I think there are different things that people will bring to different roles, and there are different strengths that you will develop in those as well. And I think it's just looking at how do you apply those in a clinical role, but how can you apply them in a non-clinical role as well? So one of the biggest things I see, and I think it's a really big transition going from being a clinician to being a non-clinical leader or even a clinical leader, it takes quite a mindset change, and we all gravitate to what we feel comfortable about. So as a clinician, that's always going to be about the clinical stuff. So in making that move, what you really want to do is step outside of being the expert clinically, but to start thinking strategically and asking questions and being curious. And so that's one of the big things. That's actually a skill set that we learn as clinicians, to ask questions, to find out what the story is. So you're not actually trying to make the diagnosis, but you're trying to work out, how do I get the information that I need? So I think that's a really key skill set. I think listening and recognizing that you're not the expert necessarily in everything. And that particularly if you go into non-clinical leadership roles, your role is as a leader, not as the expert. So it's about bringing those experts together, bringing different points of view together and bringing a team together. And those are the skills of leading people, really, which we do in clinical work as well. But you might do it in a slightly nuanced or different way to how you would in a clinical team, particularly if you're in a crisis or trauma situation, as opposed to when you're coaching or teaching or educating medical students. So there's a variety of skills that we can bring from our clinical lives, but I think it's applying them differently that really matters. And the biggest success that you can have as a non-clinical leader is being able to step away from being the clinical expert